Time to connect to Congress, a segment where we talk directly to Washington lawmakers who represent us here in the San Joaquin Valley. Right now, we are talking to a Democratic representative of California's 21st Congressional District, Jim Costa, live from Washington, D.C. from his office there. Good morning, Congressman Costa. Thanks a lot for joining us today.
Good morning, Kim. It's always great to be on Great Day, as I like to say.
The latest reconciliation bill, it sparked debate over its impact on health care. What specific concerns do you have about this bill and how it might affect health care access for your constituents?
Well, I'm very concerned about its impact on health care. Of the 5 congressional seats in the Valley, mine has the second highest use of Medicaid and Medicare. 440,000 constituents of mine, and in neighboring districts, it's 461,000 and over 400,000. And the other, these people's health care, as my mother used to say, Jim, if you don't have health, you don't have anything. Yeah. We think that the impacts not only for the affordability, people will, under the current construct of this bill, either lose their health care, some 14 million Americans, or find a diminishment in the level of access to health care. And not only that, but hospitals and healthcare facilities. Community Medical Center, for example, ranks 3rd in the nation for Medicaid patient ratio, 61% approximately. Advanced healthcare in California could see that this might lead to a $300 million cut in their hospital facilities in the Valley and their clinics. So the impact of loss of health care to individuals in our area, but around the country, and the impacts to our health care facilities, hospitals and clinics, I think could be very, very harmful to the long-term health of our nation.
You know, the Republicans are saying, though, that it's not that the health care will be taken away, just that there will be, that people will need to kind of work for it. You can't just it's not a free handout. But are there any, specifics upon how they would try to make that happen?
Well, we're waiting to see the final bill today in the form of a manager's amendment, and I'll be able to give you a more precise number on the amount of people that could lose their health care or find it significantly diminished in our Valley and around the country. But I'm very concerned about it, to answer your question, and hopefully, the final form of this bill will be more positive. But at this point, I'm very concerned.
Yeah, so and we talk about not just the people going in for the health care, but also the money that's coming into the health care providers. So that also will be, do you think, more clear once all of the, I's are dotted and the T's are crossed in this bill?
Well, we should get a better idea here in the next 2 days. But having said that, to pay for these permanent tax cuts for the wealthiest Americans and corporations, while middle-class tax benefits are temporarily provided, I don't think is a good plan, and it adds $4 trillion to our deficit. 25% of our deficit was incurred under Trump's previous administration, and they want to add another $4 to $5 trillion in debt. It's a problem. We spend more on the interest today, paying the interest of our debt, than we spend on the Department of Defense or that we spend on Social Security. So it is very alarming, and Republicans and Democrats need to work together on bipartisan solutions to deal with our debt.
Speaking of needing to work together, I'd like to go international now. The talk of trying to help find some sort of solution, peaceful solution to the crisis between Ukraine and Russia. Are you optimistic that any diplomatic solutions are on the horizon?
Well, I'm hopeful, and I'll give the president credit for trying to bring together negotiations for a ceasefire and ultimately for a peace agreement. But the president has incredible leverage in this effort by demanding that Russia, that they invaded Ukraine, acknowledge that fact, and that they understand that we're going to continue to stand behind Ukraine along with our Western allies if Putin isn't willing to reach a ceasefire that ultimately President Zelensky and the Ukrainian people believe will be a peace agreement that he will keep. By the way, he's broken 3 agreements with Ukrainian in the last 20 years, so the Ukrainian people have a great deal to be doubtful about whether or not President Putin's going to keep any agreement.
Yeah, I understand that. All right, Congressman Costa, thank you very much for joining us this morning. We appreciate your time.